right, it's noon, everyone who's joining us on Facebook Live. I think that I will begin because I have a bunch of oh dear, I've already, there we go. Anyway, let me begin our critical conversations on LGBTQ plus healthcare access. Welcome to all of you on Facebook. We're so glad you're here to learn and understand more about what we think is a critical conversation. This is part of our Lunch and Learn series at WomenNC, part of our critical conversation series of community education events. We have 4 panelists with us today who come at this topic from very different perspectives. And in a minute, I'm going to tell you a little bit about each one. I won't do them justice. It's a quick introduction, but they all have a piece of the puzzle, as it were, to understanding LGBTQ plus healthcare access. First is North Carolina Representative Vernetta Alston from Durham. Representative Alston is a native of Durham, North Carolina. She attended and received her undergraduate degree from North Carolina State University and her law degree from the UNC School of Law. She is a lifelong fighter for racial and criminal justice. Her public service career began in the Durham City Council, and she's been in the state legislature since April 2020. And among the issues that Representative Alston cares about and fights for are 2 that we will be explicitly speaking about today: healthcare and LGBTQ plus inclusion and equality. Welcome, Representative Alston, and thank you for being here. Our next panelist is Nyla Sagula, whose claim to fame in my book is that she was a WomenNC scholar in her last year as an undergraduate at NC State University. She's now a Payne Fellow at Harvard's Chan School of Public Health. And in her time with WomenNC, Nyla's project, which was entitled The State of Trans-Inclusive Healthcare at the UNC System Universities, was an exploration of the challenges that students face in accessing and receiving proper care across our state's public university system. Her work is in part the impetus for today's program. We believe our scholars' work are the tools for advocacy and can inform the larger conversation. And we're so glad you're back, Nyla. Thank you. Next up is Kelly Leach, Healthcare Outreach Initiative Manager at PFLAG Charlotte. A registered nurse by training, Kelly works with healthcare providers who seek to understand the unique health considerations and barriers for the LGBTQ plus population. She works to share best practices and practical information that will improve healthcare systems and better provide equitable and accessible healthcare for the LGBTQ plus population. She's also the mother of a transgender child and has much to share about her personal journey that informs her professional life. We're so glad you're here, Kelly. And finally, from a very different perspective, we have Naomi Goldberg, Deputy Director and LGBTQ Program Director at Movement Advance Project. Naomi describes herself as a policy strategist with quantitative research skills whose work is both socially relevant and meaningful. She has more than a decade of LGBTQ policy research experience, including having led work about LGBTQ people and the criminal justice system, the importance of marriage for same-sex couples and their families, and the challenge facing LGBTQ workers, LGBTQ women, and LGBTQ people of color. Welcome, Naomi. And I'm not sure I introduced myself. So for some of you who don't know me, I'm Maria Murray Ryman, and I'm Executive Director of WomenNC, and we all welcome you today. Now, before we get into the conversation, let me set the stage about why we want to talk about this topic now. LGBTQ plus people experience a number of health disparities in 3 areas. Oh, but first, let's talk about what a health disparity is. The CDC says health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to reach your best health that are experienced by socially disadvantaged populations. Okay, so LGBTQ plus people experience health disparities in several different areas. First, in behavioral health. The LGBTQ plus population is at greater risk of things like suicide and suicidal thoughts, mood, anxiety, and eating disorders, and substance abuse. They also experience disparities in their physical health. LGBTQ plus people are at greater risk than the general population for HIV/AIDS, obesity, breast cancer, HPV and related cervical and anal cancers, and LGBTQ plus people are less likely to have healthcare providers. And despite these health disparities, LGBTQ plus individuals are also less likely to have, drum roll please, they're less likely to have access to the healthcare that they need. They are less likely to have health insurance than the general population. They are more likely to delay getting care, especially in older LGBTQ plus adults. They are more likely to report that healthcare providers that they do see do not have cultural competence to deal with and understand their healthcare challenges. And they're more likely to report poor quality of healthcare and unfair treatment by healthcare providers. It's a problem. Why does WomenNC care? As many of you know, WomenNC is committed to ending gender discrimination and advancing gender equality. And so this issue is an important one for us. Healthcare access for the LGBTQ plus community is an undeniable example of gender discrimination. So we want to highlight it, explore it, and give you some resources for further understanding and a few ways you can do something to help. Enough of me. Now I'm going to let each panelist speak to the issues of healthcare access for the LGBTQ plus community for about 5 minutes before we get into a question and answer and facilitated discussion period. Before we do that, I want to remind you that one of the people you see on your screen, Ava Smith, my colleague at WomenNC, is monitoring the comment section of Facebook Live. As we go through this discussion, when you have questions, put them in the comments question, and we'll have time to answer them as we move through this discussion today. We welcome your comments. We welcome your questions. So please do use that feature of Facebook. So now, without further ado, let's begin with Representative Alston and her take on this important topic. Vernetta?
Sure, thank you. And just thanks for having this conversation. I think it's so incredibly important, and I'm honored to be on this panel with folks who are real subject matter experts in this area. Obviously, I'm a member of the LGBTQ community, and it's certainly an issue that, in terms of policymaking and politics is something that I've certainly prioritized in my time in the General Assembly, but also when I served on my local city council. I think it's incredibly important kind of at every level of our government. I think we've seen a lot of, positive movement and, progress over the last many years in terms of victories for the LGBTQ community, but there's still certainly a long way to go. There's still so many challenges that we face, both kind of in healthcare access and better workplace protections, just general non-discrimination protection. But something just generally that I feel, certainly encouraged by is that over these last many years, and this conversation is an example of it, just our capacity to kind of ask for questions, to educate each other, and just define the public conversation about our lives and our issues is that is progress. And I think we are on the path. While we're here to talk about the challenges, I think in large part we are on a path, I think, towards kind of full LGBTQ inclusion and equality, both here in North Carolina and in the country. I think what I hope we'll talk about a little bit when we get into the questions, and what is kind of central, I think, to our work in the legislature, and probably will be for many years, is this kind of effort towards non-discrimination protection. I think it covers so much of, covers a lot. And I think specifically in healthcare, it's just so incredibly relevant. I mean, there's so many barriers that are erected because we are not protected in the healthcare space. And that the vulnerability that we experience in healthcare is triggered by lack of housing, is triggered by our vulnerability in employment, all these things that are really central to how we move through our lives that could be corrected if we as a state extended non-discrimination protection to everyone in our state, including our LGBTQ residents and visitors. So it's something that's central to me. We filed a bill this past year, just like my colleagues filed in 2019, for the state to extend comprehensive non-discrimination protection to everyone in North Carolina. Obviously, that bill was not heard. So we'll keep working on it and hopefully make more progress on that issue in the next legislative cycle. In addition to that, we confronted some extremely harmful bills in the legislature, a couple that were specific to healthcare access, that specifically and explicitly attempted to limit healthcare access and gender affirming healthcare access for our youth, our transgender youth. And so, we spent a lot of the spring kind of thinking about educating people about the harms that that kind of legislation could cause. Unfortunately, those bills were not heard either. But I think it's a real signal to the folks who intend on targeting this community politically and specifically our youth, which I just find personally it's just so horrifying. And so it's something that we have to stay vigilant about and be ready for kind of in the near future. So it's something that's certainly going to still be top of mind for many, many years to come. So that's just my initial thoughts, but I look forward to the questions and the conversations. Thanks.
Wonderful. Thank you so much, Vernetta, Representative Alston. Let's go to Nyla Sagula, and let's have your take. You've been looking at this issue as a scholar in your continuing studies for quite some time. So let me turn it over to Nyla.
Hello, everyone. So during my time as a scholar, I chose to research the state of gender-affirming healthcare at the University of North Carolina school system. So this healthcare access is so imperative for college students because it may be the first time that they've actually had to navigate the healthcare system on their own. My research really helps highlight to me that much more needs to be done for college students to feel comfortable even expressing their gender identity or expression to campus health practitioners. And a significant way that we can do this is by increasing and improving campus LGBTQ resources. I was guided towards this work after working at my university student government, where many transgender students raised concerns about not being able to live in housing that matched their gender identity. I've continued working on LGBTQ issues at Harvard T.H. Chan School of Public Health through curriculum development and my own personal research. Though at least 4.5% of the American public identify as LGBTQ, most medical schools only dedicate 5 hours to LGBTQ-specific training. Last year, I got to assist with developing a curriculum here at Chan to see how can we be educating the next generation on transgender and gender nonconforming health. And in this course, I really got to learn more about intersex health, which is something I hope to talk about further in this discussion as we've seen a rise of anti-trans bills and trying to restrict healthcare access for the transgender community, while intersex health is still seeing a rise in unnecessary surgeries being performed on intersex youth. As an environmental health student, which is not usually someone in this healthcare access space for LGBTQ health disparities, I've been thinking a lot about how to bring environmental health theory into the field and how to increase the inclusion of vulnerable populations in this work. At the Harvard Healthy Buildings program, we're discussing gendered environmental health disparities and assessing how do the buildings we live and work in affect our health and which populations are buildings being tailored or designed towards. If you think about North Carolina, we had the big bathroom bill. So an easy way to make places feel more comfortable or safe for people who identify as trans is having bathrooms that are open to all genders instead of forcing them to try to go into a bathroom that doesn't match their gender identity, or increasing the availability of single stall restrooms. So what are ways that building design can be integrated with ensuring that LGBTQ office workers or family members feel safe? My main research, though, focuses on environmental and occupational health of incarcerated settings, where the LGBTQ community is overrepresented and deals with unequal treatment. And thinking about their healthcare access in this setting has been a unique perspective that I've been able to bring just because of my WomenNC experience. So excited to talk more about all of this.
Thanks, Nyla. I appreciate your comments and so glad really that you are continuing this work. For those of you who don't know about WomenNC in depth, we have a scholars program, and during their time with us for about 10 to 12 months, undergraduate scholars work on a topic, and you heard about Nyla's topic, access for the transgender community across the UNC public university system. Our hope is that more people like Nyla use this as a stepping stone to continue research and advocacy to improve the lives of all women and girls, whether it's across the state, whether it's internationally. So we're so pleased to hear that. And please know that that's one of the things we do here at WomenNC is we hopefully light a fire, or let the fire be lit, as it were, with Nyla. We and allowed her to continue an interest that she already had and do some in-depth research. All right, let me turn now to Naomi Goldberg, who has yet a different perspective on this work in the policy and advocacy space. Naomi?
Hi, everyone. Thank you so much for having me. And I'm really excited about this conversation, both from already hearing from the two previous speakers, but also that WomenNC is committing time to this discussion. I think it's important to note that women actually comprise the largest share of the LGBTQ community, and that's true in North Carolina as well. So I thought I would share just a little bit about what we know about LGBTQ women in North Carolina, and then I think kind of come up to the national level and look at like, where does North Carolina sit nationally, and what are the kind of key federal policy issues that are impacting healthcare access for LGBTQ women. So as I mentioned, women comprise the largest share of the LGBTQ community, and the majority of those women identify as bisexual. In North Carolina, for example, about 60% of LGBTQ people are women. And what's interesting is that 33% of LGBT couples or LGBT people in the state are actually raising kids. So I think it's important to shift our idea of who we think LGBTQ people are, and recognize that they're people living in our own communities. They may be our neighbors and friends, the parents at our kids' schools. And certainly that's true in North Carolina as well. The demographics continue showing that about 50% of LGBT women in the state of North Carolina are women of color. So again, when we think about sort of the issues around healthcare access and disparities, I think we have to think about all of the different dimensions of people's identities, whether it's being a person of color, whether it's being transgender, whether it's being an immigrant, whether it's someone who's living in poverty. And so how can we think about what barriers exist in terms of healthcare specifically? And so when we think about those issues, I think it's really important to note that at the federal level, we still lack some really robust protections, both for LGBTQ people, but also for women. And I think it's important to note that people who sit at that intersection are particularly vulnerable. So at the federal level, currently, it is not illegal to discriminate on the basis of sex in places of public accommodations, which sometimes can be places where you receive healthcare, but may just be other places like retail stores, taxi cabs, and so forth. And so that's a really kind of big gaping hole. And the other big gaping hole when it comes to sex discrimination that's important to note is around federally funded programs. And we know that healthcare is a place where a lot of federal funding comes into play. So currently at the federal level, there is a bill that's been introduced in the House and passed in the House called the Equality Act that would fill this gap for women would provide those protections in public accommodations and in federally funded programs based on sex, it would also add explicit protections at the federal level for sexual orientation and gender identity into other key areas of life. That includes employment, education, housing, and into healthcare. And I think what's important to note here is that because we do have sex protections in healthcare, many federally funded healthcare programs through other ways, not just through federal laws, the Affordable Care Act was kind of the big one. And many people know that law. Obviously, President Obama passed it and it was very exciting. But what it contained were some important protections based on sex discrimination that have been interpreted by the federal government and by the US Supreme Court last summer in the Bostock case to be inclusive of LGBTQ people. So really important for everyone to know that if you are experiencing discrimination in a healthcare setting based on your sexual orientation or your gender identity, even in North Carolina, which as Vernetta mentioned, does not have state level protections, you are actually protected under federal law from that discrimination, and you should be able to seek recourse through the Federal Department of Health and Human Services. And that means that access to health insurance, the kind of healthcare that you do receive from a physician, whether or not that doctor refuses to see you, that is all currently illegal under federal law. Now, there are gaps, and I think, as we've seen in various places, including in North Carolina, there have been efforts to push state laws that would limit that ability of trans kids in particular to access healthcare, but also to limit the ability of trans people to be treated fairly at work, to be able to be treated fairly in the employment benefits that they receive, and even in the example that came before around the kind of health insurance that students may receive within the state. So I think it's really critical that we think broadly and how can we help sort of change the healthcare ecosystem. And certainly we know, as was mentioned by Maria earlier, the healthcare disparities that LGBTQ people, particularly women, experience are quite deep. And I think that the pandemic has really highlighted much of that. And I know we're going to talk a little bit more about the impact of COVID, but COVID for me really provided a spotlight on some of the challenges that LGBTQ people, including women, already experience in healthcare, whether that's not being able to afford it because of insurance, a lack of insurance, or just living in poverty. That's discrimination because healthcare providers may refuse to provide care, or that may just be not having competent healthcare providers, which I think was mentioned just before in terms of lots of physicians and other healthcare providers don't receive good education. And so we know from research that LGBTQ people are more likely to say that their doctor treated them poorly, that they refused to touch them, if that would be appropriate, that they made rude comments. And trans people in particular say that they have to educate their healthcare providers. And so that's obviously not the situation that we want. It's not the situation that's great headed into a pandemic where we need people accessing healthcare when they need it, and trusting healthcare providers to help them navigate the pandemic. So I'll stop there. I know we're going to talk about a lot of different topics, but hopefully that sort of national landscape is a useful one.
Thanks so much, Naomi. And some of, I think, the issues that you just brought up, Kelly will address as well. So Kelly Leach, please, you have the floor.
Thank you. As Maria mentioned, my name is Kelly. My pronouns are she, her, and hers. And I come to this conversation today primarily as a parent and an ally of the LGBTQ plus community. I just want to touch quickly on what PFLAG does. So PFLAG is the nation's first and largest organization for LGBTQ plus people, their parents, families, and allies. We have 400 chapters across the country, and our mission is to strengthen families, empower LGBTQ plus allies, and elevate LGBTQ plus communities. And we do that through peer support, education, and outreach. Peer support for families is a major part of what we do. And currently in Charlotte, we have monthly peer support groups. They're currently being held virtually, and they provide a safe and welcoming space to meet other parents and caregivers of LGBTQ plus youth or loved ones and ask questions, learn about area resources, and just sort of find those supportive community that parents and family need when they are going through navigating this journey with their loved ones. We also provide workshops to healthcare providers, workspaces, schools, and other organizations. And our website has extensive information about those things. So I encourage you to go check it out. Specifically in my role as the manager of healthcare outreach, I coordinate and present our workshops to healthcare providers in a multitude of disciplines. And during our program, we basically are reviewing LGBTQ plus nomenclature. We're sharing relevant healthcare statistics, and we're discussing ways that providers can be more affirming to LGBTQ plus individuals. We also, however, share our family stories. And over again, this is what our participants comment on that really touch them. These stories open hearts and minds, and it's a way for people to hear our information in a different way. And so in that spirit, I just want to take a few minutes to share part of my family journey. So I am the mother of 3 children, and as Maria said, my youngest child is transgender. And for her, the beginning of her journey started when she was a senior in high school. And my child had already faced some significant challenges during high school. She had a diagnosis of depression her freshman year, and she had to repeat her junior year due to health issues. But even with all that she had struggled with, she had a great start to her senior year. But by the second semester, I could tell something wasn't right. And I chalked it up to the stress of college applications and started thinking that maybe she needed an adjustment in her depression medication. What I was not prepared for was that day in February when she came to me very upset and explained to me that she was questioning her birth assigned gender, which was male. She said she didn't know what she was, but she just felt completely distressed and not in the right body. I was completely flabbergasted and taken completely off guard. And unlike a lot of stories you will hear in the gender diverse community, I had zero clues that my child was struggling with gender identity. And it turns out life is messy and complicated. And although she had known for a while that something wasn't quite fitting for her, she herself didn't have a clue that she was struggling with gender issues until she had gotten into a conversation online in her gaming community about gender. And she said suddenly bells were going off in her head. So as is typical of a lot of people that come out at her age, she had already done a lot of discussion and research about this with people in the cyber world, and she was miles ahead of me. So I scrambled to get her in to see her former therapist, but I quickly realized that she needed someone who specialized in LGBTQ plus issues, and these people are difficult to find. However, not 1 month later, I was sitting in her new therapist's office with her, questioning the validity of her pronouncement that she was female and that she wanted to go on hormone replacement therapy immediately. To complicate matters, outside of my husband and other children, my child was not yet ready to come out as a transgender person. She continued to use her birth name and male pronouns in public, and she intended to socially transition the day she started college in the fall. So I was living in 2 worlds, and it was very confusing. Although senior year was difficult in a lot of ways, we got through it. And the day came to drop her off at college while also trying to switch names and pronouns in my head and out loud during what was a really stressful time. I was really envious of the other parents crying only because they were leaving their child off at school. Unfortunately, she really struggled those first weeks of college, and I then received one of those phone calls that every parent dreads. My child was in the emergency room, hundreds of miles away, with suicidal ideation, and she thought she wasn't safe anymore. So we got through an inpatient mental health hospitalization, and we grappled with a new understanding of the fact that my child was deeply depressed. After her hospitalization, she felt better and she wanted to try and stay in college on a new antidepressant regimen. But however, it became quickly clear that she was unable to function academically. And we finally made the decision for her to take a medical leave of absence and to try to treat her depression more intensely. She was also ready to come out to my extended family and live in all aspects of her life as a female. However, what followed was 6 months of medication changes and various therapies Nothing was working. And most days, my child's biggest accomplishment was getting out of bed. She had a truly deep and treatment-resistant major depression. And I think what is very pertinent to the discussion today is that my daughter had supportive parents. She had quality health insurance. She had allies that could help her navigate access to affirming providers, change her legal documents, and support her financially when all she could really do was roll out of bed every day. She had allies. Also, she is not a woman of color. So in that regard, she was miles ahead in terms of breaching barriers and accessing care as compared to a large portion of her community. Even so, as her ally, I had to battle constantly against her being misgendered, dead-named, and misunderstood, not only by the world around us, but by healthcare professionals and facilities that were supposed to be helping her, including many questioning whether her depression was a result of her gender identity. And this has a name: trans broken arm syndrome. When healthcare providers assume that all medical issues are a result of a person being trans, everything from mental health issues to, yes, broken arms. The statistics, as already have been mentioned, that surround suicide and mental health issues in the gender diverse community are startling. It is easy to see why healthcare providers would lean towards focusing on that. Just as an aside, 4 out of 10 transgender adults have reported attempted suicide, nearly 9 times the rate of the US population. 93% of those who did so before the age of 25. And 40 to 50% of trans youth will have attempted suicide by age 20. But, however, for my daughter, she was really battling depression while being transgender, not being depressed because she was transgender. My daughter finally found relief from her depression with electroconvulsive therapy, which is as intense and difficult as it sounds. But I am happy to report that finally the child I had been missing for the past 2 years re-emerged as my happy and engaged daughter. She continues to face all of the challenges of what it means to be transgender in today's society, and she is absolutely my hero. She has shown courage and resilience beyond her years, and I cannot wait to see what comes next in her amazing life journey. So thank you for letting me share our family story.
Thank you so much, Kelly. We appreciate that personal take on this really important topic. Thank you all for your different perspectives. I'm going to open up the discussion and I'm going to take it back to the policy level. And really this question is kind of probably geared to Naomi and Vernetta. And here's the question: how does federal law or North Carolina law impact healthcare for LGBTQ plus women? We've heard a little bit about the Affordable Care Act. We've heard about some legislation at the state level. Why is it important in your minds, and anyone can chime in, but why is it important to enshrine some of these things in law? What difference does it really make? So I'll leave it at that. And Vernetta, if you could start us off, that would be great.
Sure. Well, thank you. And just thanks to all the panelists for sharing their stories. Always moved by accounts and just real experiences like this. And so just know that you're just so heard and appreciated. So yes, to your question, I think as Naomi alluded to, and this is certainly evident in my work, is that while the kind of suite of protections are growing, there are loopholes, there are gaps, and there will always be places where, I see in my work where there are some of my colleagues who, attempt to restrict access to healthcare. And so there's at least in this moment, this real effort to do harm and to threaten folks in this community. And so, we need to close loopholes where we can. And I think culturally and politically, send a message in terms of our policy making that I think reflects what folks in North Carolina want. And that's, they want folks to feel protected. They want North Carolina to be a welcoming place They support comprehensive non-discrimination, you know, by the numbers. The majority of folks in this state do. And so I think, you know, kind of setting that as the bar for how we treat people, the expectations that, you know, having clear expectations for our employers, the folks who provide public accommodations for healthcare, to reduce and eliminate the ambiguity in our law, I think is of paramount importance. And, you know, in addition to, I think, the great progress that we've seen federally, you know, I can also speak to, and I'm sure everyone knows, the progress that we've seen locally. You know, I think there in the last several months, you know, since the sunset of HB 142, we've seen a lot of local non-discrimination ordinances come online in areas across the state. And so, you know, kind of following that momentum, you know, I'm hopeful again that at the state level, we'll get to a place where we can seriously consider as a General Assembly comprehensive non-discrimination protection. But, you know, like I said, there's still loopholes, there's still gaps. Folks in our community still feel vulnerable. Yeah, I think we have to do everything we can to address it. I'm happy to elaborate more, but wanted to answer your question specifically, Maria.
Naomi, before I let you, can I just ask a follow-up question, please, of Vernetta? So you say most people in the state want comprehensive protection. First of all, how do you know that? And
Sure.
Second of all, it seems to me if everybody wants it, then what the heck is the problem? So it's sort of interrelated.
Sure. And I'm referencing information that I've gotten from some of our kind of partners, like Equality North Carolina. I'm forgetting all the full names of all of our organizations, but primarily folks like Equality North Carolina who, you know, have certainly mined the data and understand that, you know, if you poll North Carolinians by and large, you know, increasingly support things like comprehensive non-discrimination protection. And so that's not from my own research, but from the research of folks who do this work kind of day in and day out. And in terms of why we haven't done it, that's a great question. You know, I think they're wonderful advocates, myself included, in the General Assembly, and, you know, our leadership, unfortunately, has not come to the table and not prioritized this for a hearing. So, you know, it remains a deeply political issue. You know, how we try to bridge the divide there, beyond what seemed like obviously compelling arguments like protecting our kids, making sure their educational environments are safe and affirming, and, you know, set them up for the future, you know, doing things that promote our economic growth, like protecting and making sure everyone has a fair and safe place to live. Those seem like, you know, kind of no-brainers to me. So why we haven't gotten there, I don't have a full answer to that question, unfortunately.
Naomi, let me pose that question to you. Why do you think it's so important to enshrine these things in law? And let me ask you to expound on that a little.
Yeah, I mean, I think that, you know, as Vernetta mentioned, we know that there's broad public support both nationally and in North Carolina. I pulled up a poll from 2017 that showed that 62% of North Carolinians support non-discrimination protections for LGBTQ people. So that's pretty high support when we think about it. But I do think we have a gap in political will on the part of leadership in many. I live here in Michigan. It's the same situation in terms of political leadership. But I think what's really critical is that we have civil rights laws for a reason, and it's to create clarity of protections, because people need to be able to understand when they go to a restaurant, how they will be treated, when they go to a doctor, how they will be treated, and that it helps us all live our lives better. And so that's part of why I think federal legislation is really the answer in this situation. And that was true in 1964 in terms of creating the Civil Rights Act that originally enshrined protections for race and national origin and for sex. And I think that, you know, we need to update those laws to keep pace with the current day. And so that means updating our federal civil rights laws to include sexual orientation and gender identity explicitly. The current situation that we're in is, without it being explicitly called out in federal law and also in state laws, is that we're at the whims of the courts and of lawmakers in terms of administrations. So currently, for example, the Biden administration has said the US Supreme Court ruling last year in Bostock that said that when you discriminate against someone because of their gender identity, it's actually at its root sex discrimination. When you fire someone because they put a picture of their wife up on their desk and they're a woman, But if a man were to do that, you wouldn't have fired him. That is sex discrimination, and that is currently illegal under federal law. The Biden administration has said, sure, the court decision was in the employment context, but we know that that's the same kind of discrimination that happens in education and in healthcare and in housing and in places of public accommodation. And so to the extent the Biden administration can, it has interpreted existing federal laws in those other areas to cover LGBTQ people. But if we have a different administration that says, you know, we don't think so, we're going to wait for the Supreme Court to rule in every single instance, that leaves people unprotected. And it's not like that's a minor thing. There are currently a lot of LGBTQ people who are experiencing discrimination in getting housing, in on the job, in employment, and in getting healthcare that need these protections. And so really having that clarity written into the law that's explicit, that people can point to, you know, that's on the wall at your employers of what your rights are as an employee in terms of the health insurance that you get through your employer, the wages you're entitled to be paid. Having that written down is really important for people to be able to live their lives well. And I think, you know, you asked about sort of the gap and why this hasn't been done. I really think it's because we live in such a divisive moment, and there isn't divisiveness in the general public around LGBTQ people and our ability to provide for ourselves and our families. But I think we're being used as a political pawn, particularly at this moment. And I think, as Vernetta said, it's really heartbreaking to see trans kids in particular used as political pawns when really they are at their core seeking to live their lives as they know themselves to be, and to be loved and to be accepted, just like we all want our kids to be. And so I think it's critical that we highlight the extent to which there's general public support, and that really this is sort of a very narrow margin of people who are trying to use this to score political points, rather than actually thinking about what's best for families and for kids and for people living in the state to be able to live their lives and take care of themselves and their families.
Thank you. And that's kind of a nice segue into a question that I'd like to pose to Nyla and Kelly. And of course, anyone's also welcome to chime in, but you sort of alluded to it, and that is sort of the culture war, or the culture that allows or permits or turns the other cheek. I'm not quite sure of the verb to use, perhaps all of them, that denies LGBTQ plus people probably their full humanity, but certainly issues in accessing healthcare. And I know Nyla has sort of looked at some of that. I know Kelly is trying to overcome it, but let me have, if I can, put Nyla on the spot and say, what's going on in your research and your understanding with the cultural problem? If Naomi's right that there's a good chunk of the population that is in favor of affirming healthcare and what's your sense of why you did what you did, Nyla, as an undergrad with WomenNC, and what's the problem across the UNC system, and why did Kelly really need to be an ally? I'll stop there.
Yeah, for me, a big challenge I felt as a North Carolinian is I was in high school when the HB2 bathroom bill was posed. It was something kind of decided on behind closed doors that I hadn't endorsed. And then our state kind of gained this reputation of being anti-trans or very un-LGBTQ friendly. And it feels like a lot of those bills that are emerging nationally are not really the result of voters saying these are the things we want. And a lot of fear campaigns being shown about how, oh, look, trans people are going to come into your bathroom and affect your children, your family, without any real evidence of those things happening, and without any way for these bills to actually be enforced, but instead just to build popularity in your base, get funding, and demonize a population that might not affect you immediately. So some of the things I learned a lot about with my work was when you're thinking about hormone replacement therapy access, for college students trying to navigate this world, does your parents' health insurance even cover this? If you are not talking to your parents, or if your parents do not accept your identity, maybe if you go into school insurance, does school insurance actually cover you getting the gender affirming healthcare you need. I know at my school, they were happy to help students continue hormone replacement therapy, but it was hard for you to start HRT at school. You sometimes had to go to Planned Parenthood or another place to start treatment and then continue at our school. So then the disparity of like, how easy is it for you to get to another site? For schools that are more rural, maybe you need a car to actually start accessing treatment that is vital just for your life. And when your life doesn't match who you are inside, of course, you're going to see increases in suicidal ideation. And that's part of why I raised the point of the COVID-19 pandemic. For so many of us, as a student who graduated in 2020, you went back home and were locked there. And for students who were out on campus, but maybe not at home, they struggled with a lot of mental health challenges of no longer being out, being called by maybe your birth name. And as we think about the impact pandemic and lockdowns will have for years to come, the LGBTQ community does have a significant challenge of having to possibly go into locations that were not safe for them because of the pandemic. Or I know a big challenge for all of us was not feeling comfortable going to a doctor during the pandemic, not wanting to catch COVID, or having surgeries that are elective delayed because of it. But for people who are struggling with gender diaspora, maybe you've been waiting so long to have a medical procedure to feel more comfortable in your body, but because of the pandemic, you had to have this delayed and thus have a significant mental health challenge as a result of having to deal with your gender dysphoria longer than you had expected because it's something you could never predict. So there's so many ways that the pandemic and lockdowns have really tied into healthcare access and LGBTQ issues. And as we're seeing with all the anti-trans bills here at the national level, even internationally with the Olympics, there's some really big conversations about sex testing. There were some African track and field runners who were told like your testosterone levels are too high and were like banned from trying to compete. And so dealing with what does testosterone mean and how do we navigate this binary world of what is man and woman in sports. And sports is a place you wouldn't really expect to have a lot of issues or challenges with gender identity, but it's something people are really liking to bring up.
Thanks, Nyla. Kelly, do you have a thought about the culture and its, and that's a broad word, so to take it as you want, but sort of the cultural influences that are, let's say, problematic for the LGBTQ plus community, especially as it results in healthcare access?
I think what comes to mind for me, especially for transgender and gender diverse people, is that discrimination against that community is an equal opportunity, concept. It crosses political lines, it crosses demographics, economics. Pretty much in general, transgender people can be discriminated against by anyone. And I have, been somewhat shocked at pushback I have received from either people in my life or people, that we've encountered navigating my child's journey. Especially for transgender people, accessing healthcare is a scary proposition. You don't, as a member of the LGBTQ plus community, and I don't want to speak for them, coming out is not a one-time process. A transgender person specifically has to think every time they access healthcare, is this a safe space for me? What can I tell this person that I'm about to receive healthcare from, especially in an emergency room situation? This is a constant stress for transgender and gender diverse people. And this is really where a lot of the mental health care issues come from for that population. It's being discriminated against and having internal transphobia because they have been brought up to, to not be able to accept who they are. That's really where a lot of the mental, healthcare issues come from.
So, and this question is for everyone. So there's a problem we've heard about, especially from Kelly, and I think Nyla brought it up too, about the lack of and I know this is partly what you do, or maybe it's in all what you do, Kelly. Training healthcare providers to be responsive to perhaps the non-binary, or and here's where my lack of expertise is not serving me well, those who do not express their birth identities or birth sex identities. So we have to change healthcare providers, we have to give them more education, but you all, including Naomi, have spoken about the general population, and me. I'm not a healthcare provider, and so I guess there's a little bit, we're drawing in on the hour. We still have a little bit more time, but what is to be done, as Lennon would have told us or asked us? What is to be done? And so, Vernetta, this is also aimed at you in some ways. What can be done legally? What can somebody like me do? What does it mean to be an ally? If we're concerned about this topic and we see these gaps, what is to be done? I'll open it up.
Sure. I think there's a lot, kind of always, I think doing events like this, I think getting opportunities that any of us have to educate ourselves and each other and our communities, just makes these conversations easier to have. I'm sure there's, as with so many issues, so many folks have questions that they just may not feel comfortable asking. And I think the more we can make spaces, it's kind of safe to not know what you're talking about, and just create spaces where people are comfortable learning, I think is really, really important. And that's, I think, an important pathway to creating allies. I think, I spoke to kind of local non-discrimination ordinances. I know here in North Carolina, if you're living in a place that doesn't have one already, I think that's a very easy, not easy, but an important and accessible, it should be accessible for you to reach out to your local elected officials, and build coalitions just in your neighborhoods, at your with your faith communities, to kind of make those kinds of changes, to enact that kind of non-discrimination protection locally. And again, I think the momentum that we see in our cities and our towns, I think over the long run would be so helpful to the change that we want to see statewide. So I think that's something that you can do. Obviously, engaging with legislators, both in the House and the Senate. I think in particular, folks in leadership, folks who, chair our committees, who really control what bills are heard and not heard. Folks, and also just representatives from the districts where you live. The goal and their job is to be responsive to you. So if they know and can put faces and stories to the policies that they're backing or not backing and should, I think I find that to always be valuable to this effort. So those things come to mind. I'm sure everyone else on the call will have some ideas though too.
Let me just not press you, but just ask you, and if this is an appropriate question, please feel free to let me know. But in your own life as a lesbian, do you find personally, so you've just given us some hints about what to do sort of politically, do you find yourself being a resource or a font of information for those who are cisgendered or who don't really understand at least part of the LGBTQ plus community? Is that something you find in your life as a kind of a public face?
Sure. I certainly hope to be. I hope, part of my goal, since I've been in the House, is to kind of, make myself available to folks, not just in my district, but just across the state. If you have questions, if you need help finding resources, I may not, I'm not a subject matter expert in any of these individual spaces, but I hopefully can be a bridge to information and to other people and organizations that can be helpful. So yes, absolutely. And I'll throw my contact information in the chat, and the organizers here are free to share it as you'd like.
Okay.
So folks should please feel free to reach out to me anytime.
Would anyone else like to address the question of where do we go from here, and what is to be done in the space that you occupy, in the world that you know?
I'm happy. Oh, you go first.
Oh, okay, I'll be quick. I would just say that if you feel that you are an ally, it's super important that you're really visible with your allyship, especially if you hold positions of privilege, because you are standing up in a space that LGBTQ plus people may feel fearful to stand in. And just, very, very simply, ungender your language, use gender neutral greetings, and be mindful of signaling that you are an ally. Put your pronouns in your signature line. Make sure in your office space, you have some indication that you are LGBTQ plus friendly.
Nyla?
I wanted to share that you're right. It isn't just healthcare access is an issue for people to deal with that are medical providers. Like one of the things I talked about a lot with policies was insurance access. And so as you think about who you're hiring and who you're helping promote, try to think of how to recruit diverse candidates, because what's really vital to healthcare access is having a job with good healthcare insurance that covers gender affirming healthcare. So maybe even as an employee advocating for better gender affirming healthcare to be included in insurance packages that your company advocates for. But even our medical schools have a lot of growth to do to increase the training available. And I wanted to spotlight, while we're saying a lot of transgender people might be needing certain gender affirming healthcare or things to navigate their diaspora, a lot of intersex youth are forced to go through surgeries at a young age. And you sometimes have intersex youth not even aware they've had a surgery performed on them until later in life. So you have a combination of some people might need surgeries or treatment, and some people are being provided treatment without consent. So more also needs to be done to ensure that people who don't want surgery don't get it forced on them.
Naomi, do you have a thought about this?
Yeah, I think I would echo everything that Vernetta mentioned in terms of being vocal in your support and letting your lawmakers know, but also being those strong advocates, whether it's in the employment context in terms of asking, what are our benefits here? What is our non-discrimination policy here as an employer? Whether that's in your faith communities, thinking about what is the language that you use, as Kelly mentioned, what do the restrooms look like? How welcoming are we? I think there's lots of places where we can signal both at a policy level, but also at a personal level, the ways in which we're being inclusive, and ultimately that helps shift the narrative. And I think the last thing I would say is talk to other people about today's conversation and what you learned and the sort of understanding that you now have of who LGBTQ people are in your community, the challenges they experience, and be that forward-facing person that can help grow understanding among your friends and family.
Thank you. Let me have Vernetta have the last word about an event that she would like to highlight.
Sure. Thank you so much, Maria. I'll be quick. So one area of the law that is also interesting and that's related is just kind of what it's like to be an LGBTQ parent. And some barriers and limitations related to reproductive healthcare access, and also just kind of what it's like to be a parent with a child and navigating healthcare. Obviously, so we don't have time to delve into that in any great detail, but as a result of our experience, last year we worked with the governor's office for a proclamation and for Gender Expansive Parents Day to help recognize and highlight parents who exist outside the binary, who don't identify as moms or as dads, for them to have a day that is theirs, because parenting is hard. And so, everyone deserves a greeting card and a nice breakfast. So that we're going to have that event will be happening again. I think it's December 5th. It's the first Sunday in December. So that's coming up. Just encourage you to keep an eye out, mark the calendar if there are folks in your lives and communities who might enjoy it. Thanks.
Wonderful. Thank you so much. And we have about 1 minute. So we didn't put up a lot of the slides. We have 2 slides with some of the what you can do that we are going to post on our Facebook page. So for those of you who are looking for links about whether it's policy and some of the links that Naomi gave us, whether it's about accessing healthcare and some of the things that Kelly and Nyla gave us, we will have slides that will be up and will be in our newsletter. We also have a Google Doc in the comment section of our Facebook page. If you'd like to get on our newsletter, if you'd like to talk to us about what you hear and what you would like to hear in the future. Thank you all very much for listening, and a particular thanks to our panelists. And because we didn't have the slides up, let me remind you of who they were. They're Kelly Leach from PFLAG Charlotte, Naomi Goldberg from Movement Advance Project, Vernetta Alston, one of our state representatives, and Nyla Sagula, a former WomenNC scholar and now a Payne Fellow at Harvard Chan School of Public Health. I also want to give a shout out to Ava Smith, who has been monitoring our Facebook page and who, with Nyla, was the driving force behind saying we need to have this conversation now. So thanks to our young people, Nyla Sagula and Ava Smith, for really reminding me of the importance of this for moving the mission of WomenNC forward. So with that, I will say thank you to you all. This will be recorded and will be put up on our YouTube channel. And so if you would like to review it or pass it along to friends, we will give you that information on the Facebook page. And if you're a newsletter subscriber, it'll be in our newsletter. So there's more ways for you to access this. Have a wonderful day, and thank you so much to all of you. Goodbye.